Welcome to the deep dive. Today, we're doing something a bit focused, really zooming in on one specific condition.
That's right. Think of it as a high-yield session, getting you the core info fast for revision.
Exactly. And today's target is the Galeazzi fracture.
Yep, we're pulling from some sharp MSRA revision notes. The goal here is clarity, speed, and making sure this stuff sticks.
Okay, perfect. Let's dive right in then. Galeazzi fracture. What is it, simply put?
Okay, so it's basically two things happening together. You've got a fracture of the radius bone in the forearm.
Right, the radius.
And crucially, you also have a dislocation, or maybe just a partial dislocation, a subluxation of the joint at the wrist, the distal radial-ulnar joint, the DRUJ.
Ah, the DRUJ. So it's the bone break and the joint problem at the wrist.
Exactly. Both need to be there. You might sometimes hear it called the reverse Monteggia's fracture, too.
Reverse Monteggia's. Okay, I've heard
Yeah.
that. So what typically causes this specific combination?
Well, the classic story is a fall onto an outstretched hand. But here's the key bit. The forearm is usually pronated.
Pronated, so palm down.
Palm down, exactly. Think about bracing for a fall that way. It seems to direct the forces just right, unfortunately, to break the radius and pop the DRUJ. Less commonly, maybe a direct hit to the forearm.
Okay, that pronation part sounds important. Are there specific, activities that put people more at risk?
Yeah, definitely. Think high-impact stuff. Contact sports are one.
Mm-hmm.
Situations where falls are more likely, obviously. And like I said, direct trauma to the forearm area. So athletes, maybe significant accidents.
Got it. So pathologically, what's the damage? What's going on inside?
So fundamentally, it's that break in the radius, usually down towards the wrist, the distal third, or maybe the middle third, and then the DRUJ gets dislocated or subluxated.
And the
The
consequence.
consequence is instability. The forearm and wrist just aren't stable, which, really messes with function.
Right, instability. Okay.
Mhm.
Now, if you see someone with forearm pain and deformity after a fall, what else might be on the list? The differentials.
Good question. You'd have to think about other forearm fractures, obviously. Maybe ones that don't involve the DRUJ.
Like just a radius fracture.
Exactly. Or just an ulna fracture.
Yeah.
Or maybe it's an isolated DRUJ injury without a fracture. Or, distal radius fracture near the wrist,
Yeah.
but without the DRUJ actually dislocating. And even full wrist dislocations.
So you really need that x-ray to see both parts.
Precisely. The combination is key for Galeazzi.
Is this fracture common? Or is it more on the rare side?
Compared to, say, a simple wrist fracture.
Yeah.
It's relatively uncommon. Yeah.
Okay. What are the sort of telltale signs? Clinically, what makes you suspect it?
Well, pain is a given. Usually significant pain in the forearm. Swelling, too. Pretty noticeable.
Right.
On exam, you might actually see a deformity. The arm just doesn't look right. Tenderness when you press over the radius is a big clue. And limited wrist movement, often quite significantly limited.
Can you sometimes, feel the instability?
Sometimes, yes. You might feel that the end of the radius seems out of place, or you might get a sense of instability or clicking at the DRUJ itself.
Okay. So suspicions are high. What imaging confirms it?
X-rays. No question. You need good views, AP and lateral, so front and side of the entire forearm.
The whole forearm, not just the wrist.
The whole forearm, wrist, and elbow.
Hmm.
You need to see the full picture and make sure nothing else is going on. Sometimes if it's complex or you're worried about ligaments, maybe a CT or even an MRI.
Gotcha. And treatment. How do we fix a Galeazzi?
Generally for adults, it's surgery. The standard is what we call OROF open reduction and internal fixation.
So opening it up, putting the bone back, plates and screws.
That's the one, fixing the radius fracture securely. And then the DRUJ often needs attention to repairing the ligaments, making sure that joint is stable.
Okay. Is it different for children?
It can be, yes. In kids, sometimes not always, but sometimes you can try what's called closed reduction, basically manipulating the bones back into place without surgery, maybe using traction, and then putting a cast on.
Ah, interesting.
Yeah, but even then, some might need temporary pins, K-wires, maybe under anesthesia if it's tricky. And regardless of age or method, rehab is absolutely vital afterwards.
Right, physio for strength and movement.
Crucial.
What's the outlook generally? What's the prognosis like?
With the right treatment done properly, the prognosis is generally pretty good.
That's good to hear.
Yeah, but it does depend on things like how bad the fracture was initially, the patient's age, and importantly, how well they stick to the rehab plan. But functional recovery is definitely achievable for most.
Okay. What about the downsides? Potential problems or complications?
There are risks, like with any major injury. The radius might not heal correctly. That's malignant or non-union. The DRUJ might stay unstable or keep dislocating. You can get stiffness, limited motion in the wrist or forearm rotation. Nerve or blood vessel injuries are possible, though less common. Chronic pain can be an issue, and there's a risk of developing arthritis down the line.
So getting it treated right early on is key to avoiding those.
Absolutely. Prompt, appropriate management minimizes those risks significantly, and sticking with follow-up and rehab is just as important.
Okay, this has been super clear. Any quick tips or mnemonics to help lock this in for revision?
Yeah, definitely. How about this? Galeazzi grips DRUJ. G for Galeazzi, R for radius fracture, and it grips or involves the DRUJ.
Galeazzi grips DRUJ. I like it.
And remember the reverse Monteggia idea. Monteggia is ulna fracture plus radial head dislocation up at the elbow. Galeazzi is the reverse pattern, sort of. Radius fracture plus DRUJ dislocation down at the wrist.
Nice distinction. Helps keep them straight. Maybe an example question.
Sure. Picture this. Patient falls, outstretched hand, pronated, forearm pain, looks deformed. X-ray shows a distal radius fracture and DRUJ dislocation. What is it?
That's got to be a Galeazzi fracture.
Bingo.
Fantastic. So wrapping up the big takeaway, Galeazzi means you've broken the radius and it dislocated that key wrist joint, the DRUJ.
That's the essence of it. Remember that combination.
Definitely revisit this if you need a quick memory jog.
And if you're looking for more detailed MSRA revision resources, you should head over to passmsra.com.
Plus, there are extra free revision materials available at freemsra.com, worth checking out.
Absolutely.
Great stuff. Thanks, everyone, for tuning into this deep dive. We'll catch you on the next one.